The 5 steps in the nursing process are assess, diagnose, plan, implement, and evaluate. We use the mnemonic ADPIE, A-D-P-I-E, to help us remember that. Now, the reason it's so essential you remember these steps in sequence, ADPIE, is that as a nurse, you should never do something until you've done the step before it. First you assess, then you diagnose, then you plan, then you implement, and then you evaluate. It's really simple. ADPIE, A-D-P-I-E, assess, diagnose, plan, implement, evaluate. The next time you take an NCLEX exam, or the next time you take a test in nursing school, or the next time you see a patient on the floor, I want you to remember these steps. ADPIE, assess, diagnose, plan, implement, evaluate. You're never going to forget it now. ADPIE. Let's talk really briefly about each step in the process. First is A, for assess. When we assess, what we're doing is we're gathering all the information we have available. We're looking at everything, we're taking vitals, we're using objective and subjective data to gather everything that we can to really see what's going on in the situation. Then let's talk about D, diagnose. Once we have all of our information from assessment, we can then diagnose. We can then say, okay, this is what's happening, this is what's going on. This is all the information I have, and this is what's happening with this situation, with this patient, with this question. Then P for plan. Once we have all of our information gathered and assessed, once we've made a diagnosis in D, now we're going to plan. That's the P in ADPIE. So with all of this information, we're then making our plan. What are we going to do next? Now that we know what's happening, now that we know we have all the information, what are we going to do about it? That's the plan part. We make the nursing care plan, we plan how we're going to answer the question, or we plan what we're going to do next. Then we move on to I. I is for implement. We've made our plan, that's great, but without implementation, it's basically worthless. With I, ADPIE, the I in ADPIE, we're implementing our plan. We have our plan, we've written it down, we know what we're going to do, now we actually do it. That's implementation, that's implementing the plan that we've created. Now the E, ADPIE, A-D-P-I-E, the E stands for evaluate. Having a plan, implementing that plan, assessing, getting all of our information, making a diagnosis, all of that's good, but did our plan work, or do we need to adjust it? So the E stands for evaluate. We've implemented our plan, now we're seeing how our patient responded to that. We're seeing, was this the right answer? Did this work? Are we getting the outcome that we expected? So that's evaluate. The next time you take a nursing exam, I want you to work through this. You never jump to evaluate, you never jump to plan, you never jump to implement until you've gone through assess, diagnose, plan, implement, evaluate. You always work in this order. What can happen to a lot of students is they want to diagnose or implement before they've either assessed or planned. So for example, you might get a question about a patient shows up shaky. Okay, so what should you do? The first thing you need to do is assess. One thing you can do to assess that is get a blood sugar. Don't just jump automatically to thinking that this is a patient having a seizure or that this is a patient with low blood sugar. Get that blood sugar first. That's part of your assessment. Once you have that blood sugar, you get it back, it's 32. Now you have a diagnosis. Okay, this is hypoglycemia. The patient is shaking, they have hypoglycemia. Now what's our plan? Our plan is to give them a little bit of glucose. We give them that glucose. Now we see what happened. Okay, we evaluate. Okay, the shaking's gone away after 15 minutes. We're good. That's the way it works. Never jump to your diagnosis or your implementation until you've either assessed or planned. And that's where I think I see most students make mistakes, is they automatically jump to a diagnosis when they have one piece of information. Now guys, over at NRSNG.com, we have an entire huge database on nursing mnemonics. I want you to head over there, use that database. It's completely free. We have images, we have audio, we have everything you need to keep this straight. We also have a cheat sheet on nursing mnemonics. I want to make sure you guys get that. It's a free PDF download that you can use to keep some of these things straight, to keep some of these mnemonics in your mind, to help you memorize and retain the information that you've learned. All right, guys, I want you to go out and be your best self today. Happy nursing.